Thank you, everyone, for being here. Sorry we're a little bit delayed. We wanted to make sure we got all the updated information from Governor Baker, who I spoke to last night. We're joined by City Council President Justin Hurst, who is here as we continue to communicate with our City Council and School Committee. President Hurst, Justin, I deeply appreciate you being here. And we're also joined by the President and CEO of Bay State Medical Center, Dr. Mark Kerouac. I deeply appreciate him taking the time. He will be giving an update. And Dr. Robert Ruse, who's the Chief Medical Officer of Mercy Hospital Trinity. I am joined by my cabinet heads, who will be giving an update after I speak about the overall situation. I also want to send out to the residents and to the business community of the city of Springfield. I deeply appreciate all your continued efforts. We have to continue to work hard to starve and kill this virus. It is essentially important about the social distancing needs to occur. The quicker we can cut this curve down, the quicker we can get back to an semblance of our regular lifestyles. I know it is very difficult right now not to be around loved ones that you can't see, not to worship, whether in a church, a mosque, or a synagogue, not to be out and about. But we're all doing this for the common good of each and every one of us. We will get through this together as one and for the better. And again, I'm very proud of my city team. They've been tested and true through a number of natural and man-made disasters. First announcement is that we're going to coordinate along the lines of the schools, and City Hall will remain closed. City facilities will remain closed to the public until April 7th. April 7th. So that is an extension from the March 30th date. Though essential operations will continue. Thank you, Al. Al, you and your facilities team have done a tremendous job keeping everything clean. That was Al Rodriguez. Good man, veteran. But we're going to continue essential operations and services going on. Let me just give you a quick update. Frontline services continue. Springfield Fire, Springfield Police. Just Saturday morning at 5 a.m., they made 3 great saves at Sumner Avenue apartment complex at the end of Long Hill Street. So they are out there, as are our police men and women who are continue making arrests. I want to thank DPW. Chris Signora, who'll be speaking, but DPW, they're out there. They're picking up the trash, they're picking up the recycling, they're picking up the bulk. They will be doing snow operations today. I don't think we'll be in a plowing, but we're going to be doing sanding and salting because the weather's going to be warmer. I want to thank Helen Colton-Harris, the health shop, the inspectors who are out there. I want to thank my building inspectors. I want to thank my code enforcement inspectors who continue to still be out there. I want to thank the behind-the-scenes financial people, operations, clerks, treasurers, TJ Plant, 311, dispatchers. We continue to operate. I deeply want to thank my staff, my internal staff. They've been wonderful. We continue to work, and that's extremely important. I also want to thank all the medical providers. I can only imagine how stressful this has been to each and every one of them and their families. They are on the front lines. Now, Lieutenant Governor Polito, we've spoken a number of times, and Governor Baker Governor Baker just gave some updates today, and Pat Carnevale, who's his rep, and then MEMA. One thing, and I want to thank General Keith, the National Guard call-up, we were able to work out that our first responders will be held harmless. The Springfield Police Department has 60 National Guardsmen and women. That would be a tremendous hit if any or all were called up at that time. Fire has about 30 National Guards people in fire. So they're going to hold harmless the first responders. I believe that goes also to medical personnel, Dr. Kerouac and Dr. Roos, and again, spoke with Governor Baker last week on that, so we deeply appreciate that. He also, and he's indicated too, and this is for the hospitals, the Army Corps of Engineers are available if alternative sites are needed. He has issued daycare regulations, again, for first responders, that's on site. I also, with our seniors, we are going to be feeding our seniors. I want to commend Helen Carlton Harris, Commissioner Helen Carlton Harris, and Sandy Federico, my Elder Affairs Director. We contacted well over 1,000 seniors who go to our senior centers, and we're going to be helping them out with any type of food or meds that they need. We're also coordinating with our homeless population, and if alternative sites are needed, we will have that. And with Commissioner Clapwood, we're also working on domestic violence issues. If Liz Deneen, the YWCA, if alternative sites are needed, we're going to have that. I want to give a special shout out to Pat Sullivan and his team. Al Rodriguez made a cameo appearance, but the facilities management's been absolutely outstanding. Little things mean a lot. Everybody's on this team. Constant cleaning going on in all our schools and all our physical plant buildings, and they even have that gun that they use that's used in the hospital. So I want to give, it's important to give them a shout out. I also want to thank the private sector. Tower Square Hotel has stepped forward. I think it was about 8,000 masks. La Quinta has offered their services. I know updates. They continue to work with MEMA on their needs there. We spoke with the governor on that, and Dr. Bruce, again, as they work with La Quinta. And they're also going to remind you about the procedures, how you go about if you feel you need to be tested. What are the proper procedures to do that? We also want to indicate with Helen that we're going to be able to, through Superintendent Warwick, we have found some masks which we're going to be with our city side services and also to the hospitals and Caring Health Center. Superintendent Warwick will also expand on, we expanded our feeding sites, 15 sites. Brookings is the newest one. Also educational packages going out to all the grammar kids at those sites. I think we're well over 1,800 meals that were served just this Friday, and we're giving meals over the weekend to our students. Commissioner Clapwood, again, will give an update on the public safety attack that we have, and Commissioner Calvi also on that. DPW, we spoke of with Director Chris Signoli. Pat Sullivan on the park side. We're going to continue to keep the parks open. It's important for people practicing self-distancing that they have some type of outlet within reason, but the hoops are coming down. And I'm sorry to say that, but people are not abiding by the situations of congregating together. Basketball hoops will be coming down ASAP, and signage will be going up. Tim Sheehan, my Chief Development Officer, will speak to you on our restaurant fund and our business fund. And again, I ask each and every one of you, your favorite restaurants, many are still open doing takeout, continue to support them. If there's any legal or human resource development, Solicitor Ed Pakula's here, and Bill Mahoney, my Labor HR Director. And again, the back room finances and operations of cities continue, and if needed, the TJ plant can give an update on that. Before I turn it over to Dr. Kerouac, I'd like to, what the governor just said, and again, that's why we were delayed. He has not indicated that there is a mandate for stay in place or shelter at home. This is an advisory. He has indicated, though, that non-essential businesses can only operate remotely and they must be shut down as of tomorrow, Tuesday at 12 noon. That answers many of the questions where Helen and I had to give an advisory to certain businesses that we do not have direct control. The state has ordered that. So non-essentials shut down. The list is on, we'll be putting it on all our websites. First responders, obviously, have to come to work. Medical, hospital, pharmacy, child care as designated by the state. Grocery stores will continue to stay open, and anything that supplements those grocery stores will continue to stay open. Gas stations will continue to stay open. Package stores will continue to stay open. And that is a question many people ask. Medical marijuana, which we have one in Springfield, will continue to stay open. Recreational marijuana, which we don't have one as of yet in Springfield, in the state, are closed down. Manufacturing, types that deal with pharmacies, medical supplies, anything that supplements will continue to stay open. Restaurants with takeout procedures or delivery procedures and that are practicing the social distancing will continue to stay open. Financial services will continue to stay open. Governmental services, as deemed by the body, will continue to stay open, which we're pretty much doing to keep operations going. Construction, following the guidelines of what is put forth by the state, the governor, can continue to work as long as they are practicing the social distancing or everything that goes along with that. But you have to please check that list. That's extremely important. So, with that, let me bring the experts up. And again, I am so thankful that we have Dr. Kerouac here and Dr. Roos. Again, Dr. Kerouac is renowned. He was an infectious disease. That's how he cut his teeth many years ago, and what they're doing. So he'll give you more specifics about Bay State. And again, I think Dr. Kerouac and Dr. Roos will also speak to you about what is the procedure to properly get tested if you need to get tested, because we don't want to take away from anybody's time with the patients that Bay State and Mercy have already. There's criteria, and I believe it's through your primary care first and how you would go about that. So at this point in time, and again, I'm deeply appreciative, the President and CEO of Bay State Medical Center, Dr. Mark Kerouac.
Well, good morning, everybody. And Mr. Mayor, thank you for your leadership in this crisis. You've really been a great partner. I also appreciate the work that's gone on and thank the commissioners and the department heads for cooperating with us as well. We've been working very closely with Chairman Richard Neal, Secretary Mary Lou Sutters, the governor, the lieutenant governor, and we've gotten great support from the legislative delegation as well in terms of helping us really change the way we provide services to the public. There's also been excellent networking through the Mass Hospital Association and among the Western Mass hospital CEOs to try to coordinate our efforts. I think we're really working well as a team. At Bay State every day, there is an incident command center led by Dr. Andrew Artenstein, who's a well-known expert in biodefense and another infectious disease expert like I am, to solve problems, create new workflows, and accommodate increased testing and treatment. I'm going to give you the Sunday morning numbers at Bay State Health. The Monday morning numbers will be released before noontime. As of Sunday morning, we had 39 positive patients with COVID-19. 22 of them were inpatients. The rest were recovering at home. We have had one death, as was released. 271 negatives and 290 where we're still awaiting the test. 40 of those are in isolation in the hospital. It is clear now that the virus hits all age groups, although it's hardest, it hits the hardest in the elderly and the frail. We're continuing to plan for a surge in cases. We expect this to happen over the next couple of weeks. As of today, the entire Mass Mutual wing has been devoted to COVID-19 patients, which means 30 ICU beds and about 150 standard med-surg beds. We're expecting that we could flex up to 110 to 120 ICU beds and over 300 beds, so really over half the hospital being dedicated to COVID-19, possibly more. Our community hospitals may provide another 200 beds, some of those ICU as well. There are plans moving forward through the Department of Public Health and the MHA to coordinate regionally in terms of bed capacity, bed supply across the whole state of Massachusetts with local coordination on a regional basis. And there's also state-level organizations organizing and planning around additional structures such as field hospitals. I personally believe that we're ways away from that, given that we have hundreds and hundreds of beds that we can bring online in a hospital, which I always feel is a more efficient way of delivering this kind of care, but only time will tell. We've been putting a lot of effort into securing the supply chain for personal protective equipment for our dedicated and hardworking healthcare workers. We're grateful for many of the donations that have come in. These have included cash, protective equipment, various other kinds of material. There is information about how to donate, and I'd certainly encourage anyone who's able to donate appropriate materials to do so to your local hospital. You could check out our website at baystatehealth.org if you're interested in that. We're also working with some local manufacturers to bring on additional capacity in the long run. These include not only masks, but viral sampling swabs. There's been a tremendous amount of ingenuity and can-do attitude among the manufacturing community, and we're very happy to see that, because some of these supplies are in short supply and everyone across the nation is competing for them. Finally, let me point out that we are still open for blood donations, and interested in blood donations is the Level 1 Trauma Center for Western Mass. We've moved all blood donation activities up to our Whitney Ave site at the main lab in Holyoke at Bay State Health, and would encourage either routine or first-time blood donors to come and donate. There have been a number of developments on testing. Last time I spoke with you, we were looking at a 3 to 4 day turnaround for testing through LabCorp in New Jersey. Quest in Marlborough, another commercial lab, has come online. They're offering roughly 12-hour turnaround, although they're starting to get stressed as well. This has allowed us to accelerate testing for our Bay State Health employees and also for the Springfield first responders. We soon hope to be doing testing in the Bay State Central Lab up in Holyoke. The equipment and platform for doing this was blessed last Friday by the FDA, and we're working to expand the availability of reagents and swabs, which is currently the rate-limiting step. Chairman Neal and Lieutenant Governor Polito are helping us twist arms with the manufacturers to try to get to the head of the line on that, and we're optimistic that we're going to be able to do that. Once we do, we're planning to open drive-through centers across the service area for Bay State Health patients. We've also made some difficult changes in our visiting policy. It's a pretty simple one, no visitors. We have a couple of exceptions for people going through end of life and through the birthing process, that they can have one visitor at a time. And we appreciate people's understanding. We know that this puts a strain on the personal side of healthcare, which is so important, but really safety does come first, which is why we've had to put this in place. Lastly, I would say in terms of ordinary citizens watching this telecast, staying informed really is the key here. We do mean what we say when it comes to social distancing. I'm observing it at home. All of my team is. I would urge you to take a look at the information we're updating on baystatehealth.org or on mass.gov. If you prefer to use the phone, the 211 system is a good source of information too. If you're feeling sick with a cold, a cough, flu, or fever, you should call your doctor or call an urgent care center. They will advise you on whether it's best just to stay put at home or if it sounds like you're sick enough to come in and need testing. We're also aware of the impact that social isolation and the loss of wages has on underserved communities and folks with behavioral health issues, and it's stressful for everybody, but particularly stressful for those vulnerable populations, and something we're watching very closely. I understand it's a frightening and a strange time for everybody, but it's important to remember that for our community, this is not the first time. I was standing outside getting ready for an interview outside the old building at Springfield Hospital, which has been in that same place since 1889, and I reflected that, you know, if these walls could talk, they would tell some amazing stories. They tell stories of the Spanish flu or polio or AIDS. This is just the next chapter, and I am determined that our communities will be proud of the work that Bay State is going to do to get us through this crisis. I'm very grateful to the leaders of our Incident Command Center. Dr. Artenstein and his immediate crew have spent long hours inventing brand new systems, reassigning people, scouring the country for equipment and testing supplies, and taking care of our team members and the stresses they're going through. And I'm particularly proud of our frontline caregivers. They are the real heroes in this story. We and they are doing all we need to do to be there for you, and we will continue to do so. There is still a long way to go here, and there is going to be a lot more difficulty, but I have no doubt we will get through this, and we'll be a stronger community because of it. So thank you, and I look forward to answering any questions later.
Thank you, Dr. Kerouac. Just to, I want to thank Dr. Kerouac for being able to assist our first responders. It's deeply appreciated because they're at the front of response. Billy Baker, my communications director, just gave me what Governor Baker has issued just on the COVID-19 essential services. But Exhibit A, an order of the governor assuring continued operation of essential services in the Commonwealth about closing certain workplaces. And now, here's a change now. Prohibiting gatherings of more than 10 people. So that is a knockdown from 25, which starts tomorrow at noon. Again, prohibiting gatherings of more than 10 people. So we're going to have to, we will adjust accordingly. Also, I know Helen will speak of it. Dr. Kerouac gave overall, but as right now, I believe in Springfield, there's 3 cases and I believe 12 in Hampden County. Again, that was as of yesterday or early this morning, but Helen will go into that. Now, on the Mercy perspective or Trinity healthcare perspective, again, I'm deeply appreciative. The Chief Medical Officer, Dr. Robert Roos, is here. Dr. Roos?
Thank you, Mayor Sarno, for your leadership in this crisis. When we are faced with something like this, it requires clarity and fortitude, and you have both of those in spades. You've been a tremendous partner and leader for the city of Springfield during this time. At Mercy Medical Center, we are also grateful to the support of Congressman Neal's office and the entire Massachusetts, and particularly Western Massachusetts legislature, as you've worked collaboratively with us to help us continue to provide the care that we can to meet our community's needs. Thank you also for the donation of masks to Mercy Medical Center, as this is something that our frontline providers can use immediately to help protect themselves and care for patients that are at risk or with the novel coronavirus. And I too am inspired by the work that our providers are doing each and every day, and so I want to express my gratitude to all of our care providers, clinical on the front lines, including our first responders, as we meet this crisis head on. Last week, when we provided an update, we had yet to have our first positive test at Mercy Medical Center, and our efforts were squarely focused on preparedness and prevention. This week, we continue to have those focus, but we've aggressively moved towards the immediate response readiness and expansion of capacity to meet the inevitable surge of patients with COVID-19 in our community. Last week, we had our first 2 positive COVID-19 patients, both of which that time, those patients were at home recovering well. And since then, and as of this morning, we have had 8 COVID-19 patients test positive. We have now tested over 250 patients through our emergency departments and inpatient hospital units. And important to note, we still have over 150 of those tests pending. We have yet to have any deaths related to COVID-19, and we're working each and every day to ensure our care and treatment protocols are delivering the best possible care for these patients. Our efforts this week are focusing squarely on our surge plan, which ensures that we have the capacity to meet the demand within the community, and that has included focusing on 4 major areas of care: our emergency department, our critical care areas, our intermediate care areas, and our medical surge areas. In our emergency department, knowing that there will be continued increases in volume of patients that may be at risk or have respiratory symptoms, we've expanded to additional areas, both external to the hospital and internal to the hospital, to create dozens more beds for patients needing emergency care. Inside our hospital, we've expanded our ICU to be able to double its capacity in the event that we have patients that are in need of critical care and ventilatory support. We have developed geographic areas for each of those types of patients such that we would escalate the response according to a capacity that may be reached, and have focused on deploying dedicated care teams to ensure that we minimize healthcare personnel risk, as well as create the expertise necessary to develop some advanced treatment. Accordingly, we are looking internally and externally about additional spaces, what may be used as additional or alternate patient care spaces in the event that we would need. We've opened up capacity amongst our medical providers by looking at and taking advantage of the emergency order that allows providers who are licensed in other states to receive an emergency physician license in the state of Massachusetts within even 1 day. So as we look to our hospitals in Connecticut, we look to expand our capacity of providers who can cross-train or cover in additional areas so that we will meet those needs together. Our outpatient areas continue to focus on having patients call ahead if they have symptoms to ensure that we can keep our capacity available, as well as restrict the number of visitors that enter into our ambulatory areas. We have restricted non-essential elective surgeries, non-essential elective imaging procedures, and are evaluating any non-essential ambulatory visits so that we can be able to retain our provider workforce. That is our most vital resource during this time. Some areas of focus now remain on testing capability and resources and turnaround. We have continued to work with commercial labs, both LabCorp, Genesis, and now also Quest. We've seen some reduction in the turnaround time, as was mentioned, but we still are not yet where we would like to be. At Mercy Medical Center, we also have the ability to move towards an in-house lab testing with our platform once that is able to be released, ideally in the next several weeks or in April. We continue to need to focus on the conservation and adequate supply of our personal protective equipment, a vital resource that we have to ensure that our healthcare personnel are protected from exposure and infection. So we are stewarding those resources. We are looking for additional supplies, and we are ensuring so we can ensure that we have that supply when it's needed. We have also implemented much more secure visitor and security policies at our institutions, limiting access to single points of entry, and also instituting non-invasive checks of temperature to ensure that visitors or other folks who may be entering the facility do not have a fever and are redirected to their primary care providers if they have any symptoms or risk. We also have a no visitor policy at our facilities with some compassionate exceptions for end-of-life care or guardians of children or others. And lastly, we continue to look for ways to collaborate as a community. This is a community disease, and it's one that's going to take community solutions. We want everyone to be safe, to be healthy, and to work together so that we can flatten the curve on this epidemic. Regionally, we have set up a hotline for the public if they have questions about COVID-19 or the novel coronavirus. Individuals can call between 8 a.m. and 8 p.m. to the following number, 888-786-2790, to have your questions answered or directed to further clinical resources as needed. If you're interested in making a donation for personal protective equipment or other equipment that could be utilized, we are accepting these donations at our loading dock at Mercy Medical Center. You can also reach out to us through our website, mercycares.com, or through social media. And lastly, I just want to thank all the providers and first responders that are working to impact this crisis each and every day. Although we are physically keeping our distance, and we should, we certainly feel the closeness of this community and the support. And together, we are stronger. Thank you.
Well put. We might not be able to be there physically, but we're there all together in spirit. Helen Carlton Harris, my Commissioner of Health and Human Services, who has done yeoman work. She's been my point person on it. She'll give you some updates. She'll now also clarify with the governor's edict. This really puts the close on non-essential on some of the advisories we put out pertaining to barber shops and other entities now that you will have to be closed, nail salons, massage parlors. She'll go through that. The edict now has come from Governor Baker, and that needs to be adhered to starting tomorrow at 12 noon, Tuesday 12 noon. So Health and Human Services Commissioner Helen Carlton Harris. Thank you. And she looks great today, by the way, too.
Thank you, Mayor. Good afternoon, good morning. It has been, for most of us, really a very challenging time. And I want to start by thanking the staff at the Department of Health and Human Services who are working every day to make sure that they are checking our infectious disease register to assure that we are up to date as far as the data is concerned in the city of Springfield. Let me say what we have in our data right now that we are following are 3 positive cases. I don't want anyone to think that that is a finite number. That number is changing, and so that's why we are here saying how critical it is that the community work with us to be able to stem the tide of this virus. What we know is that the CDC is telling us that 38% of the individuals who have a positive or are hospitalized are between the ages of 20 and 54. I say that because I appeal to young individuals to understand that although you may get better, you can carry this virus and impact those individuals in your household who may be older and who may be more likely to experience mortality. That means die from the infection. And so young individuals, I am asking you not to take this lightly, but to care about and be compassionate and understand that in your hands could potentially lie the life of individuals that you love. I also want to thank those child care providers who are providing emergency services at this point. There are emergency child care centers that are opened in the city of Springfield and across actually the Commonwealth. It appears that the YMCA is stepping up. So there are emergency child care for first responders, healthcare workers, and others who are essential services who can receive child care. 1500 Main Street is open, the YMCA in Wilbraham. That particular YMCA venue is opened as well. I have asked my staff to activate the Medical Reserve Corps. We have a Medical Reserve Corps in the city that is made up of individuals who could be physicians, nurses, or community members who have been trained in public health practice and are prepared for public health emergencies. I am asking that phone calls be made to those individuals to see if they are available as we think about how we are going to potentially need to do contact tracing. The other point that is important is the rumors that are really running rampant, not only in the city of Springfield, but across the Commonwealth and nation. I would ask you to try to identify your sources and not spread rumors. If you have an individual who is positive and need to be contacted, that will happen by a medical provider or it will happen through the Board of Health. I have gotten many phone calls around individuals who have been using scare tactics and fear. We are all experiencing fear. We are all afraid. We are all concerned. But when you take a rumor and spread it, it creates heightened anxiety at a time when we are absolutely trying our best to be able to ramp down anxiety to the degree that we can. We want to take care of our children. We want to take care of our mental health. And I told you that health is physical, mental, spiritual, and emotional. We need all of those quadrants of our health to be healthy. And so I ask individuals to take care of your mental health as well as your physical health and your emotional health. The governor has issued orders, but in his order, he did talk about essential workers. And it's important to acknowledge that public health, community health workers, including those who compile and analyze data, are essential. Workers that manage health plans, billing, and when you cannot work from home, you're important to our systems as well. If you can work remotely, that's what we're asking, but those individuals are important. Individuals who perform security, incident management, emergency preparedness are now essential as well. Workers who coordinate with other organizations that keep us healthy are essential as well. Our public health infrastructure is important, and we need to pay attention to prevention, intervention, as well as treatment. You know what you can do to prevent this virus. Each one of us has a responsibility to wash our hands, stay at home if we're sick, cough into our sleeve, make sure that we are connecting with our primary care physicians if we're having any symptoms at all. Again, don't flood the emergency rooms. Please take the opportunity to call your primary care provider. That individual should instruct you on what your next step should be. The healthcare workers, I've heard from many of my friends who are physicians, nurses, CMAs, the individuals who clean the floors. Every person working in a hospital setting is putting themselves at risk, particularly our healthcare workers. My friends who I know who are very concerned for themselves and their families, they're out there every day going into what they know could be a potential concerning situation for themselves and their family. So I would ask that we remember those individuals and do what we can to stay out of the hospital if it is not necessary. Individuals experiencing acute fever, cough, particularly respiratory concerns, really need to get in touch with their primary care physician. I'm asking all of us to please, let's work together. Those barbershops we talked about, those hair salons that we recommended, those tattoo parlors, the governor's order is clear. Close your doors. Those gymnasiums that we have had to go around and ask to limit participation, close your doors. This is serious. And what concerns me every day is that people don't understand this crisis we're in at this moment. Please, I'm asking you, each one of us has a responsibility as we move through this crisis. The mayor has said it over and over again, and you've heard it. We will get through this together, but this is a time where we need to make sure we are working together. And I thank you so much for the residents out there who have called me, who have been on the front lines trying to make sure they are reporting concerns that they see. I do appreciate everyone's support at this time. Thank you.
Thank you, Helen. Well put. Now I'm going to bring up Superintendent Dan Warwick, and when you speak to other parts of the state, I know early on how far ahead we've been, whether it's our schools or what we put in emergency preparedness, police, fire, and what we're doing health-wise. So Superintendent Warwick will give you a brief update as we continue to feed our students, our children, and their families, and we continue to educate remotely, and now packages are being distributed for our grammar school level, elementary school level kids at each and every of the 15 sites, including the weekends, which packets are given out. Superintendent Dan Warwick.
Thank you, Mayor. Good morning. As the mayor said, schools are closed until April 7th for now, but the staff has been extremely busy. We've set up 15 sites. We added Brookings today to distribute meals to families, and we actually distributed meals to 1,800 families on Friday, so it's growing exponentially every day, and we actually sent them home with packets for the entire weekend. So staff is working hard on that. My staff is also working very hard to provide as much academic work for students as possible and communicating with families and that, whether it be remotely. We're also distributing hard packets at our 15 sites for the students at the kindergarten, 8th grade level. Again, our staff has been very vigilant. We also were able to order some extra masks prior to this issue, and now we're donating those masks to Bay State, Mercy, and our public safety officials here in Springfield. But we're doing all we can to stay in touch with families to get through this crisis. But I think these feeding sites are growing, and something that's very important to the community. The sites are all on our website for people to follow, and there's a load of academic information on our websites as well for families. Thank you.
Thank you, Superintendent Warwick. Again, just to echo what Commissioner of Health and Human Services Helen Carlton Harris succinctly and emotionally said, this is serious. We're trying to be very prudent about this situation because we also want to tamp down hysteria, but especially to the young people out there. I know you love and respect your family or your close friends. If you're not going to think of yourself, think of them. And as I think Dr. Kerouac might have alluded to it, and Dr. Roos, definitely Helen. The age factor now has dropped. Nearly 40% now within that millennial age, up to 50. So you really have to take this seriously. Again, we have to starve and kill this virus, and social distancing is the key. We'll now get our public safety update. Commissioner Cheryl Claproot and Fire Commissioner B.J. Calvi. Commissioner Claproot will come up, and I really appreciate her men and women in blue, their continued efforts. Law and order continues. We also are very compassionate, but unlike some other cities across the country that are starting to look the other way, we will not do that. Law and order will continue. We'll be compassionate. Arrests will continue to be made. Assistance will continue to come from our police department. So I'm looking you squarely in the TV cameras and the eyes here that law and order will be maintained. Commissioner Cheryl Claproot.
Thank you, Mayor. Good morning, everyone. Yes, I've talked to the mayor about it. I have his support, and I've talked to the command staff. And what we need right now is not more stress on people or neighborhoods. I think that a feeling of calm comes with a feeling of being safe. It's hand in hand. So we are not about to relax any laws or any enforcement of any laws. We are out there. I am fully staffed right now, and I don't think moving the bar right now to put up with underlying small crimes is what's needed in the city. We will continue our enforcement. We ask for your cooperation and your help. Please do not put added stress or undue stress on the officers at this time. I'm asking you to adhere by the good advice that you've gotten from both Bay State and Mercy. If you are feeling under the weather or you feel like you may be coming down with something and it may be COVID-19, please do what they are telling you to do, and that's to contact your physicians or your urgent care facilities and go from there, and not to call 911 and ask us to be put into a bad situation. When bad things occur, good things step up, and that's exactly what I have to say to you from my partnerships here with my fellow department heads and commissioners. And the school department has come through for us. Thank you, Dan, with some donations of the N95 masks. Commissioner Calvi has been there for me, Commissioner Carlton, and her information, and Department Head Pat Sullivan with the cleaning supplies needed and your help with keeping our facilities and our cruisers safe. Thank you, Pat. Right now, we have 3 isolated officers. They isolated and quarantined themselves before any illnesses came on because of travel restrictions. I am awaiting tests on 5, 2 recruits and 3 officers. They will be given the tests, and again, I thank Bay State and their ability and willingness right now to step up to the plate so that I can get first responders tested as quick as possible in this environment, because it's important for the mentality of all the other officers involved. We can't help but not come in contact with each other at calls. We can't help but not come in contact, even though I've separated as best as I can, and we are using 5 different facilities. When an urgent call comes in, there's no stopping these officers getting together. So I thank you for that. It'll put people at ease quicker, and it'll let me know what I have to do from that step forward. Right now, we are fully staffed and we are fully operational. Police work goes on. I will tell you that there was a victim of a shooting last week on Carew Street near Chestnut. There is a warrant being issued for the assailant in that crime. I will tell you that Springfield had a stabbing yesterday that was quite significant. The subject is still being treated, and I will tell you that there was a warrant being issued for his assailant. I will tell you that victims of domestic violence are being assisted daily. Yes, domestic violence has spiked up a bit, but yes, we are dealing with it. Emergency restraining orders and regular restraining orders are being issued and enforced. And although the shelters are experiencing being full at this time. We are working it out. We will continue to work it out. We will make sure that people feel safe in the city, no matter what we have to do. So again, I'm asking you, this is a time where your actions affect so many others. It's not just what you do affects you and you can be held accountable. What you do affects you and so many others. So please help us out in obeying these restrictions. Please, small businesses, we are going to enforce it. As the mayor directs, as the governor directs, we will be out there doing what we have to do. I'm asking you to voluntarily comply and don't put added stress or added responsibility on the officers. They don't want to be out there doing this type of work. This is new for them also. I'm hoping, and what I've seen so far, is that most people comply because it's the thing to do and because we all have loved ones and family members who are probably susceptible more so than we are. So please comply and don't add the added stress or responsibility on the officers at this time. Thank you.
Thank you, Commissioner Clapper. I'd also like to thank Mercy Hospital. Dr. Roos, you had helped us out in a pinch too with a couple of first responders. My apologies for missing that. And I also want to thank from our college academia, President Mary Beth Cooper from Springfield College, who has reached out to me on availabilities, which we, on our contingency plans, and also Vince Miniacci from AIC. As we continue to, we hope we don't have to do it, but we do have contingency plans if needed. Fire Commissioner Bernard B.J. Calvi is here, as with Commissioner Clapper, with outstanding leadership. Again, these are paramilitary type establishments. And Saturday morning, I was there later on after they did their work, but they made 3 saves out of that apartment complex in the corner of Sumner Avenue and Long Hill Street. So they're still out there on the front lines saving lives. And that's why, again, to our young people, please, adhere to the advice that is given. These firefighters and police officers and medical care providers have stressful jobs as it is. Without further ado, Springfield Fire Commissioner Bernard B.J. Calvi.
Thank you, Mayor. Good morning. First, I'd like to tell everybody we are open for business still. We are still out there every day doing our jobs. For real estate agents, the state has deferred 26F inspections. So for 90 days, if you're transferring a deed on your house, you do not need to get a smoke detector inspection to transfer the deed. It used to be the seller was responsible for the 26F inspection. Now the buyer will be responsible 90 days after the fact to get the 26F inspection for the deed transfer. So those have been deferred. I want to talk to everybody about fire safety. We've had several fires over the last several days. Make sure you're shutting your stoves off. We've had a couple of cooking incidents where people have left their stoves on that have caused fires. We've also had some issues with candles. Everybody's at home, make sure your candles, you're not burning candles or leaving them unattended. Lastly, children are out of school. Parents, make sure your children are not playing with matches and starting fires for experimentation purposes. These can get out of control very quickly and cause large problems. Lastly, smoking. Everybody's at home. Make sure you're disposing of your smoking materials appropriately. We've had 2 large fires over the recent weeks where they were started by smoking materials being carelessly disposed of. Make sure you're disposing of your smoking materials appropriately so they're not causing fires. As the mayor said, on Saturday morning, we had a 3-alarm fire on Belmont Avenue. Due to the efforts of the Springfield Fire Department and Springfield Police Department, we were able to rescue everybody out of that building, and the fire was extinguished without any major injuries. Everyone needs to be careful so we do not have incidents like this as we're moving forward with everybody at home. It just heightens the need for fire safety in the community, and we need to be careful about this. Last thing I'm going to talk about today is if you are feeling sick and you do call 911, make sure you identify to the call taker that you're having symptoms of flu-type symptoms, elevated fever, shortness of breath. coughing, or if you have been quarantined and are at home and you need to call 911 for further assistance, identify yourself to the call takers that you are in quarantine for COVID-19 so we can take the appropriate measures when we come to see you to make sure we're protected. Thank you very much.
Thank you very much, Commissioner Calvi. I just get word, Union Station will continue to stay open. Trains and buses will continue to operate out of Union Station. With that, I'm going to call up our DPW Director, Chris Signoli, as services continue on through Department of Public Works. Director Signoli.
Mayor, thank you. The DPW right now, we are working as business as usual with regard to trash, recycling, and bulk pickup. I really need to thank my staff. These are the guys that have been out there since this started and will continue to be out there doing this work. We are adjusting hours for certain activities within DPW, and what I ask for the residents on that is we get calls on a daily basis when somebody's trash is usually picked up at 8. They call at 8:05 wanting to know why their trash isn't picked up. There's going to be some changes to that possibly, so please work with us and do not flood 911, or excuse me, 311 with calls on that. Trash and recycling will be picked up. We assess our staff on a daily basis. Right now, our operations and solid waste staff there have been no adjustments to their working hours, and especially today with some snow, sleet, and possibly rain later, we'll be doing the necessary sanding and salting of our roads. Our department issues construction permits to all entities working in the roads. Spring construction usually would be starting right about now. That has been put on hold for at least a week. However, we are processing permits for all emergency work. So any work of Springfield Water and Sewer, Gas Company, Eversource that has emergencies in the road, permits are being issued, and that work, I can assure you, is going to get completed. Our Traffic Commission and Board of Public Works has been put on hold for a while, so necessary petitions and approvals through those entities will be addressed once we get back to normal business. Final approvals on those need to go through the City Council, and we know there's going to be a modification, or has been a modification of the City Council meeting. So basically, the bottom line for DPW, trash and operation services are business as usual. Any major issues, also please call 311 and we will respond as needed. Thank you.
Thank you, Director Signoli. And Chris also indicated to me the hot patching, the plants haven't opened up yet because we'll have our pothole crews out there. Chris, I think they're going to be opening up hopefully next week, next Monday on that. So that's important to know. And again, he mentioned with the City Council, again, we're working very closely with City Council President Justin Hurst, how we can remotely do meetings that have to be done, or for situations that have to be passed for the good of the residents and the business community here in the city of Springfield. Governor Baker did allude to that they're going to take a look at when the state income tax is due. So I would assume that he will be making an announcement in the near future. As you know, on the federal level, President Trump had indicated that federal filing is July 15th. Working with the City Council too, I have extended payment due dates on certain fees. We've also requested the legislature, I know they're working on that with the governor, to see if there can be an extension of real estate tax. By statute, by law, I have no control, nor does the City Council either, any control over that. So we're looking for extension. We're hopeful that the state, the governor and state legislature will give us some guidance and extension on when real estate taxes are due. Until and when we get that, that stays as is. Again, myself nor the City Council has any direct control statutorily on that. Pat Sullivan, Director of Parks and Facilities Management, has done a wonderful job, especially on the cleaning process that continue on, and very innovative in buying those cleaning guns, disinfecting guns, which are used in many of the hospitals. So Pat will give an update on facilities and on some stringent moves that are going to be taken with our parks. Pat Sullivan.
Thank you, Mayor. Good morning, everyone. Our priority continues to support police and fire personnel at a high standard. The city is utilizing electrostatic sanitizing equipment to ensure the highest standard possible in the removal of bacteria and viruses in our buildings. This equipment is available in all police and fire facilities, City Hall, Tapley Street, Health Department, TJO, and park facilities throughout the city. The Park Department will be removing all basketball hoops throughout the city parks starting today. We are open for walking, jogging, and passive recreation only. All pickup games are canceled, and thanks to Commissioner Clapprood and the Sheriff Nick Cochi and the Mayor, we are starting patrols as of last week, so these rules and regulations will be strictly enforced. And they have to be enforced, as our Commissioner of Health and Human Services stated. This disease is spread by contact with people, so we have to respect those decisions and we have to enforce those decisions. Signs will be posted throughout our parks and buildings to remind everyone of the importance of safe social distance guidelines. And finally, I'd like to thank my fellow cabinet members that I work with, from the mayor, his chief of staff, Tom Ash. Dan Warwick's worked closely with us in helping us get the sanitation guns in our hands. Helen Colton is always there at his moment's notice. And like DPW, we still have to work business as usual. I was on the phone with Chris Signola yesterday on a block pipe. So I think it's important for the residents to know that as we're dealing with this, we are still maintaining the city at a high standard, and we want our parks open, and soon, hopefully, our buildings will be reopened. And finally, to the staff of the Parks and Buildings Department, they understand their role and responsibility, and no one has complained or refused to come into work. They know that it's important to support the police and fire department and for the public to be able to get out into the park. So we ask the public to respect that, and we can all get through this. Thank you.
Thanks, Pat, very much. We're in the business of business, and Tim Sheehan, who's my Chief Development Officer, we're trying to think outside the box, working with TJ Plant, my CAFO, on bringing some type of financial relief and recovery to our restaurants, and also examining the small businesses, and in turn to the workers, the employees of that. He'll give you an update on that. We're continuing to review all our options that could supplement what is being done on the federal level and on the state level. Lieutenant Governor Polito has announced, and she had told me earlier, there's $10 million more coming in on that. The federal and the state, I believe, and Tim can expound on it, are loans. Tim, myself, and TJ Plant, we're going to try to the best of our abilities to see what we can do on grants for restaurants, and as we start to explore small businesses. So stay tuned on that. But let me call up my Chief Development Officer, Tim Sheehan. Tim?
Thanks, Mayor. These very necessary emergency orders have obviously had a huge negative economic impact on many of Springfield's small businesses. The mayor and I have recognized that that is a significant impact, and the city is trying to come forward with assistance to help those businesses continue operations and hopefully maintain some level of employment. With regards to the restaurant program, we're anticipating that the application and the notice of funding availability will go out to all of those that have contacted us by tomorrow. We're looking at a very short turnaround on that application because our intent is ultimately to get that money out to the applicants as quickly as possible. The other issue, as the mayor alluded to, staff is looking at best practices with regards to trying to figure out how we can expand the grants to small businesses beyond restaurants, and hopefully we'll be announcing that in the near term. Thank you.
Thank you very much, Tim. As we coined it, prime the pump. We want to prime the pump. Now, for legal and HR updates, I know Ed, Susie's sister Ed Pakula has a legal update, and we'll see if Attorney Mahoney does, might not. That can be said publicly. And again, Mr. Plant, TJ Plant, we've spoken about finances. He's doing some behind-the-scenes things right now. So City Solicitor Ed Pakula.
Thank you, Mayor. I guess I want to thank the vast majority of our citizens and our businesses who've worked hard to comply with the changing orders that seem to change every day. But I do want to mention that between the health commissioner and the police commissioner, we're going to be working to make sure we're on top of all enforcement efforts that are needed. We're going to coordinate with the district court to seek whatever non-criminal or criminal penalties that may be required. But the overall message is the vast majority of everyone going around the city, I can see, are working hard to try to figure out how to comply. We're going to have that guidance up on our websites so everyone can read the governor's order, everyone can see the list of what's essential. Even if it's not essential, the governor has urged everyone to try to work remotely to keep businesses going. If for some reason you think that you may have an essential business but you're not listed, the governor has a link to try to get added to that list. So, legally, these are challenging times. The rules are changing. I want to thank everyone to try to cooperate as we figure it all out.
Thank you, Solicitor Pakula. And again, most of the businesses are complying, and we deeply appreciate that. There have been a handful that have not, and whether it's Health Commissioner Helen Colton-Harris in coordination with Police Commissioner Sheriff Clapper, we had to pay some visits late Friday and some over the weekend also too, and explain to them, and they did follow through. But if they don't, we will pursue the cease and desist, and which means that puts your licensing in jeopardy. Attorney Mahoney, I don't know if you have any updates at all, or you're all set? Okay, and then I think financially we spoke with TJ Plant. So right now, I really want, I deeply appreciate that, again, Dr. Kerouac took the time to be here, and Dr. Roos from Mercy took the time to be here. So I want to, if there's any questions of the medical experts and professionals, I take those questions for them so they can take them first so they can get back to their operations. So any questions of Dr. Kerouac?
Yeah, I've got a question for Dr. Kerouac. On the telephone town hall you did with Chairman Neal last week, you said that you had about a 10-day supply of personal protective equipment, and that was one of your big worries. Has that situation changed now? Do you have more of a supply?
I can't give you an exact number. We continue to get supplies from multiple sources, but the demand for supplies is going up briskly because the number of cases is going up briskly. We could get back to you on the exact number, but it's, I think it's a daily effort to make sure that those supplies are secured, because we're using them up in much larger quantities than we have historically, and everyone in the country is trying to get their hands on adequate amounts.
Are masks and gowns and things like that being reused?
Routine masks are not, and they are generally not a shortage area. Gowns have not been reused. They are generally not a shortage area. The specialized high filtration masks with very fine filtration called N95 respirators can be washed between usages or sterilized, and there's guidance from the CDC that they can be reused up to 5 times with proper washing and care. We're also moving toward more permanent kinds of eye protection, permanent goggles or face shields that people would own personally, and so that therefore we wouldn't have to keep changing out stuff.
Have the procedures changed at neighborhood health centers, like the one at Mason Square? When people walk in, are people being allowed to walk in off the street? And if so, I mean, what happens when they come inside? Are they being screened?
we're encouraging people to, first of all, call ahead, and a lot of outreach has been done to convert routine appointments to televisits. And so it's actually, I was at High Street just last week, and things were very quiet there because a lot of it had been converted to telehealth sorts of visits, and only folks that really needed to have some physical exam thing checked out were coming in. We have procedures in each and every one of our walk-in centers so that if someone comes in with with respiratory symptoms, they're immediately given a mask, and then they are taken to see a provider with protected gear on. As you may have heard, we've set up a kind of bypass track for our large emergency room at Bay State Medical Center, where there will be dozens and dozens of stations for triaging people immediately to that.
Thank you.
Any other questions of Dr. Kerouac? Say again, he has to get back. I don't know if Dr. Roos had to leave also. Any other questions of my cabinet heads and or myself? If not, I really want to thank the media. You've been fantastic in getting this information out. We will continue to update you daily if needed, but as far as set times, we will be back here unless something comes up that is hopefully a positive and not a negative. We will be back here at 10:15 next Monday, March 30th, and knock on wood, hopefully that maybe could be the last time. But if we don't do what we're supposed to do, again, we want to be prudent. We're taking this seriously, and we want to tamp down on hysteria. And we have to, again, starve and kill this virus. So even when we start, the curve goes down and we're turning the corner, we have to stay ever vigilant. And again, I know the physical contact is lacking right now, but there's plenty of spiritual contact that is going on. So please, to each and every one of you, whether young or wise in years and wisdom, please adhere to the health information, the social distancing, the personal hygiene. If we do that, and I know we will get through this together as one and for the better. We've done it before. I cannot say enough about our city team, tested and true, through tornadoes, freak nor'easters, natural gas explosions. We're able to get through it. We will get through this. So to each and every one of you, every little thing means a lot, And to each and every one of you and your families, I wish you good health and Godspeed. Thank you very much.